My name's Margaret Oldfield, and our session today is called Making Canada's Complex Web of Disability Supports Easier to Navigate. We have simultaneous interpretation for this section, so our Francophone delegates can feel comfortable speaking in their first language. One of our panelists will present in French. If you want to turn on the interpretation, push the interpretation button on the bottom of your Zoom screen. Excuse me, I'm having technical difficulties. There we go. I'll start the session off by talking about a synthesis that I did for the Center for Work Disability Policy of reports from the 4 Center for Research and Work Disability Policy clusters on disability supports in 8 provinces. The thing that struck me most about these reports was we have a very complex web of programs in Canada of disability supports, and it's no wonder that Canadians with disabilities get stuck in it. So what we're going to focus on today is challenges with navigating programs and possible solutions. When I'm finished my short presentation, I'll ask the panelists to speak about their ideas and solutions. And after they're done, I'll invite you, the delegates, to contribute your ideas. In the discussion, you can use the raise hand button to speak, or you can put a comment in the Q&A box if you don't want to speak. Please use the Q&A box rather than the chat box. There we go. So here's a slide by Vaughn Yuan, one of our panelists, that illustrates the complex web of disability supports. Each of the 10 bubbles on this slide represents an income support program. And there are in fact many more provincial programs that offer non-financial supports. So imagine this slide being full of bubbles. They all have different providers. They serve people with impairments from different sources like work or not from work or military service. And they're funded by either taxes or individual contributions. One of the major problems with navigating this complex web is that there are few links among programs. The challenges reported by the reports include applicants generally being on their own when applying to different programs, challenges with the programs themselves sharing information about clients, including privacy legislation, and that programs are separated across different government departments. Possible solutions include making provincial and federal programs more comparable and compatible, having one agency in each province to administer all programs serving people with disabilities in each province, and helping clients of provincial programs apply for all the federal programs that they're eligible for. Another problem is that disability is defined differently and inconsistently among provincial and federal programs, and this affects the eligibility of applicants. Some challenges are that the definitions differ in terms of how long an impairment has to last and how severe it is. They may focus on the impact of impairments on activities of daily living or on earning capacity. In particular, clients with multiple mild impairments may not be eligible for programs, even if the cumulative impact of their multiple impairments is severe. The programs also tend to ignore physical and social environments that disable people. Some possible solutions include having a similar definition across all federal and provincial programs, making program eligibility criteria more flexible, and ensuring that programs cover people with episodic disabilities. And then there's problems and challenges with accessing benefits. The first thing that potential applicants need to know is the benefits actually exist. This they might find out from agencies that they're consulting, people that they know. You ideally want them to find out from the programs themselves, and particularly when they know a benefit exists, how to apply for it and where. In this, the reports found that there was little guidance from program staff in navigating all the possible programs that applicants could access. Some possible solutions are advertising programs in plain language, in multiple formats, and through channels that reach people with disabilities, for example, libraries. The reports also found that advocates in community organizations help people navigate programs. And we've just found in a session that I just attended that this is often employment service providers, but it might be other community agencies like disability advocacy organizations, churches, healthcare centers, and so on. And then there's the issue of applying for benefits. People who were interviewed for the provincial reports reported confusing instructions, a lot of time that they took to gather documents, the multiple forms they had to fill out, and also that the ways to apply for benefits varied. They could be in person, by mail, by telephone, or online. And not all these methods are available in each program or even in each province. Importantly, the applications required applicants to emphasize deficits, not assets. Some possible solutions are having one application for all programs serving people with disabilities in each province, telling people the multiple ways they can apply according to what suits their abilities or their resources, where they can find information, who can help them, and how to contact these people. And lastly, programs need to recognize applicants' strengths. Lastly, I'd like to focus on a message from one of the reports in particular about the emotional impact of trying to navigate problems. These emotional impacts affect people's health, not just their mental health, but their physical health. Some of the challenges reported by research participants were confusion from unclear information, and particularly from mixed messages they were getting from program staff. They also reported feeling anxious, particularly about whether they'd be approved or not, which impacted very heavily their financial stability. Again, there was a lack of staff help in navigating programs. Some people reported being treated rudely or mocked, and sometimes they were shuffled among caseworkers and had to repeat their stories multiple times. Some possible solutions to this emotional impact are to train program staff in the lived realities of people with disabilities, how to help clients navigate application processes, and for program planners to focus on person-centered service delivery and involve clients in program planning, as one of our previous speakers, our keynote speaker today, talked about nothing about us without us. Now I'd like to move on to our panelists. I'm going to refer you to their biographies on the website, so we leave more time for people to speak. Our first panelist is Marcy Votor. She's the founder and CEO of Disabilities Without Limits. So I'll stop sharing my slides, and then Marcy, you can go ahead.
Thank you, Margaret. Yes, my name is Marcy, and my mission is to help voiceless people that have disabilities, and we help them fulfill their vision. I found Disabilities Without Limits about 15 years ago, but at that time I was deaf, and I was still trying to navigate the system. Because I didn't sign. I woke up deaf and had no idea what to do. So while I was navigating the system, I started this company, and I got together with other people with disabilities, and we all tried to navigate the system. One thing that I really learned is that people want, when they come to us, they want to be heard, they want to be helped, and they want to be hired. Okay, that is what they want. Now I'm going to tell you about two cases that we had. We have many, but I'm going to tell you about two. One was a gentleman that came in. He was a veteran, and he had post-traumatic stress and severe anxiety. So when he came in, actually he had gone to a couple other places, and to be honest with you, he didn't feel safe. He didn't feel like he could tell them what was going on. And one thing he loved about us, I'm going to brag here, but one thing he loved, we all have disabilities. Our company hires only people with disabilities. We're pro-disability. So when he came in, he felt really safe. He had 3 meetings, and he told us about what was going on with him, with his post-traumatic stress and his severe anxiety. So what he needed, we got him in a company, and he was in a cubicle at the very end of the hall where it was nice and quiet. He had his back at the entrance. Now, that is what he requested, so that's what we did. We also got him a monitored mirror. And if you can look that up, but it's a mirror that sits on your monitor, and what it does, it looks at the entrance. So he always sees the entrance. That helped him because when someone startled him, because of his disabilities, he would automatically go, and it would affect his mental and physical being. Okay, he would completely shut down. So with the mirror, that helped. We also talked with the boss, and they were more than happy to help. And we got him a mat. And what it is, it's a monitored mat. We put it at the front of the door. So when someone comes in, they step on the mat, and what it does, it goes on his belt or it goes on his computer. And the type he got, it gives like a little beep. No one else can hear it. You can get other types, but the type he wanted, it gives a little beep. There's also other types of, like me, if you can't hear well, you can get a light, a signal. So if you're deaf or hard of hearing, it just has a light that brightens up. Anyway, his does a beep, and it lets him know if someone's entering the room or near the room before they come in. That was fantastic. So he's doing really well. He's been talking to us. We keep in tabs on him. We also talk with the supervisors, and that's going really well. Our second case was a middle-aged woman. We got a referral from her specialist and the doctors. She was middle-aged and she had a stroke. And what happened was she had the stroke, but after about 8 months of rehab and rest, she wanted to get back into the work. They agreed. So she came to us, and she already had a service dog, and she really wanted the service dog to be part of wherever she went. We got her into a job. They agreed with the service dog. There was not a problem. And also I have to say, we also got her with the program. I'm not sure if you heard of it, but it's called TTRS. Okay, it's touch, type, read, spell. It's absolutely, look, I could go on and on about it. It really helps many different disabilities, but it really helped her because what it is, it's a program, it's a sensory keyboard. And so for her, when she had her stroke, some words didn't come automatic like it used to. So when she's using the keyboard, it reads it out to her. So that was really helpful. Also, it's good for people if they're not doing too well with typing. Different disabilities, they're not great with typing. So this was really good because it was like having your own cheerleader telling you, way to go. So she loved the program. I can't say enough. It's great with people that have autism. It's great with people that have attention deficit. It's a fantastic program. For her, it really worked. So we did really well with her, and she's still with the company. And like I said, they agreed with the service dog. One thing that helped with that, we had a doctor and we also had a specialist that gave letters. So I just want to say that in these cases, we did really well, but please remember everything that people are telling you, that not all cases are, rosy and great, like I'm showing you. In fact, only 17.9% of people with disabilities are getting jobs. So we have so much work to do, but all these people here that are coming to this are working to make it better. So thank you.
Thank you, Marcy. Maintenant, nous avons Normand Boucher, il est chercheur au Centre interdisciplinaire de recherche en réadaptation et intégration sociale à l'Université Laval. À vous, Normand.
Oui, Marguerite, merci. Ouvrir ma présentation. Voilà. Merci pour l'invitation. Comme Marguerite l'a mentionné tout à l'heure, le portrait qu'elle a fait, c'est de la situation au Canada. Lorsqu'on parle des programmes, c'est vraiment un portrait d'une situation complexe à l'intérieur de ça et qui est récurrente depuis plusieurs années. Par expérience, pour l'avoir abordé par le passé sous différents angles, notamment avec des collègues qui ont une belle contribution par rapport à cette problématique-là. Je pense notamment à des gens qui nous ont quittés trop tôt, à Catherine Lippel et à Marcia Rio, avec lesquels j'ai travaillé dans ce cadre-là. J'ai choisi aujourd'hui de présenter une approche qui conjugue un peu les deux perspectives. Regardez ça. Je vais vous mettre qui donne les deux perspectives, à la fois axées sur les droits, sur l'exercice des droits, parce que le travail, c'est d'abord un droit, hein, à ces volets-là. On va regarder un petit peu le background et les principes à l'intérieur de ça. On va regarder la question du fonctionnement du système comme un problème sociopolitique par rapport à ça. Et les avenues de discussion possibles à l'intérieur de ça. Le choix que j'ai fait, c'était de proposer une approche plus large, plus macro, qui permet de voir, et qui va nourrir des discussions aussi pour voir que la question du travail, de l'intégration au travail, c'est pas juste la question du travail, c'est aussi la question du transport, c'est aussi la question du service qu'on peut avoir à domicile, c'est aussi la question de l'accessibilité. Hein, je pense que ça va l'accessibilité des environnements physiques et pour le handicap invisible aussi, cette dimension-là, c'est des choses qui ne sont pas toujours prises en considération. Donc, ce que je vous parle, c'est un travail qu'on a fait il y a quelques années avec Catherine et autres par rapport à ce volet-là. On s'est intéressé à ces questions-là sous l'angle de la compensation et des indemnités. De ça. On a d'abord défini aussi, je pense que le principe de base pour nous, pour comprendre tout le développement du système après, qui est excessivement important, c'est que le handicap, c'est une question collective et non pas une responsabilité individuelle à l'intérieur de ça. Pour moi, c'est basé sur les 5 principes étant un exercice du droit. On retrouve dans la Convention, on parle de la Convention des Nations Unies sur les droits des personnes en situation de handicap. On parle de la dignité, du respect de la différence, de l'accessibilité, notamment, ces volets-là. En lien, on peut faire le lien directement avec l'article 28 ou encore avec l'article 27 de la Convention qui porte spécifiquement sur le travail. Peut-être pour reprendre rapidement, Marguerite l'a bien montré tout à l'heure, mais il y a vraiment une difficulté qui est liée à l'évaluation des incapacités et des besoins à travers les systèmes au Canada. Une des grandes difficultés, la première diapo que Marguerite a montré, illustre très bien la situation, c'est qu'on a des régimes qui sont basés sur la cause de l'incapacité. Ça génère des formes d'iniquité à l'intérieur de ça, sur ce volet-là. C'est une des causes très importantes par rapport à l'accès aux mesures de compensation. La définition des besoins qui sont couverts, qui varient beaucoup en fonction des causes, en fonction je vous dirais, des territoires également. Je vous disais qu'il avait pris une approche plus globale. Je pense qu'un des avenues intéressants à moyen terme, c'est d'établir un régime unique de compensation. Les coûts additionnels qui sont liés au fait d'avoir des incapacités à l'intérieur de ça, À l'époque où on a travaillé sur ces questions-là, on se basait, notre modèle, c'était la Nouvelle-Zélande. La situation là-bas, peu importe la cause du handicap, c'était pris en charge, il n'y avait pas peu importe la cause et le revenu de la personne. L'autre dimension qui est excessivement importante, sous le principe du droit à l'égalité, on tient pas compte du revenu à l'intérieur de ça. Puis je pense que dans une perspective à long terme, il est intéressant de conjuguer, de distinguer les deux, les coûts supplémentaires, puis d'inclure un régime universel de revenus également, qui permet à la personne de couvrir un minimum nécessaire pour être actif socialement. Sur une base à plus court terme, on pourrait développer, si on veut être pragmatique, puis répondre à des besoins qui ne sont pas dans 20 ans. D'accord, on pourrait développer un guichet unique qui permettrait d'orienter les gens vers les bonnes ressources en fonction des connaissances qu'elles ont, puis de leur profil, puis de leurs besoins, puis d'avoir une participation, disons, qu'on souhaite plus active, puis qui pourrait faciliter la navigation de ces mesures-là à l'intérieur de ça. Et je pense que cette contrainte-là, c'est lié beaucoup à notre système qu'on a politique, puis au fait d'avoir des différents régimes qui sont basés sur la cause. Je m'imagine souvent là, en face de dire qu'il faut être un peu géologue lorsqu'on aborde ces questions-là au Canada ou ailleurs aussi, parce qu'il y a des couches successives de mesures et de programmes qui ont été mis en place pour répondre à des besoins à chaque fois spécifiques qui se cumulent puis se contredisent parfois, ce qui fait que ça vient complexifier un petit peu la réponse aux besoins pour les personnes qui ont des capacités. Voilà.
Merci, Normand. Moi, je me fais sur l'écran. Okay, thank you very much, Normand. Now we have Yvonne Yuan, who is Research Associate at Open Policy Ontario.
Good afternoon, everyone. It's an honor to be here, and thank you all my fellow panelists. Today, I would like to share with you two concerns my colleague and I found in our recent research. First, the welfareization of disability incomes. Second, disadvantages of social assistance as a form of disability income. In response to those two issues, we also offer some recommendations. In fiscal 2018 and 19, the total expenditures of disability income programs in Canada, both private and public, were $37.8 billion. Of this amount, 30.1% of the total were spent in social assistance, which was approximately $11.4 billion. 20.1% was in private programs, 18% in CPPD and EI sickness combined, 15.6% in workers' compensation, and 9.4% in all disability tax measures combined. Social assistance is by far the single largest set of programs. Please note that public employer disability income program expenditures and private accident insurance are not considered in the above numbers. In 2005 and 6, social assistance disability expenditures comprised 25.9% of disability income expenditure. This means that the share of disability income accounted for by social assistance has risen by over 4 percentage points since then. The share comprised by other programs as a whole, therefore, continues to fall. It is safe to say that the human face of a welfare payment in Canada is now the person with disabilities. However, social assistance and its disability component was designed as a needs-based program, which means it was not originally designed to be a program to help people getting to work or back to work. For instance, Ontario Disability Support Program, the ODSP, is not indexed to inflation. It has severe restriction on assets. Currently, it's $40,000 for a single person. It also has a cap on the level of gifts that a recipient may receive and deducts most other income sources, including other disability income sources, at 100%. The restriction also serves to reinforce the insistence that a recipient must live in poverty in order to receive benefits. In response to that, Open Policy offered the following recommendations. First of all, we must engage people with lived experience. Here I quote, "New processes are needed to address both unfactored considerations as well as assumptions made about the cost of participation for low-income people. In terms of systemic issues, we suggest that programs allow social assistance recipients to keep more of the money they earn before their allowances go down. They should allow family and friends to help out without restrictions. They should also allow people to save and keep a meaningful cushion of money and to reduce costs without penalty. We must stop onerous reporting, including reducing systemic overpayments. We must try to remove barriers and stop cutting people off or suspending them for minor infractions. In terms of a promised new Canada disability benefit, it may be advisable to have a consistent definition of disability that could be applied to all programs as a base standard. For instance, based on the disruption of personal development made by disabilities. This would assist with navigation. Now is a time full of opportunities to change. We should make existing programs better in advance of larger reforms. And thank you. I give the stage back to my fellow panelists.
Thank you, Yvonne. Now we have Alexis Butkin. She's affiliated with McMaster, Wilfrid Laurier, and York Universities. Over to you, Alexis.
Good. So I am here to present on some examples of community-based approaches or solutions to the myriad of challenges that we have just been talking about in the complex fragmented system of disability services and supports. This is certainly not an exhaustive list of various community-based approaches to system navigation issues, but just a few examples that I've come across in various work and projects that I've been involved in over the past few years. So the first one I want to just describe is by the Council of Canadians with Disabilities, which is basically an umbrella organization of people with disabilities, of other organizations of people with disabilities, so organizations run by and for people with disabilities. And it takes an intersectional and human rights-based approach to supporting system navigation led by and for people with disabilities across Canada. They're developing, working on a system navigator service to increase access to system navigation services for people with disabilities to access benefits and supports that they're entitled to receive. The purpose of this project is to address the underusage of federal programs that are related to the difficulties and the challenges in finding and accessing programs among people with disabilities. So these are programs like the Canada Pension Plan for Disability, the Disability Tax Credit, the Registered Disability Savings Plan, for example, and supporting people who are eligible to access these to access them, regardless of their geographic location, their socioeconomic status, race, national or ethnic origin, color, religion, sex, age, mental or physical disability. The other project I want to talk about is a little bit different. But related. It's a project facilitated by the Canadian Union of Postal Workers called the Special Needs and Moving On Projects is the title that they've given these projects that have been undergoing for over a decade. They provide support to members of the Canadian Union of Postal Workers and the Union of Postal Communications Employees, or the Public Service Alliance of Canada, who have children with disabilities. So adult or young children with disabilities. Parents who are part of these projects receive supports from what they call special needs advisors, familiar with provincial and community resources and services for children with special needs. Those are their words. They provide access and support to access financial support for expenses directly related to their child's disability and opportunities to connect with other parents through these projects and programs. So they provide support to union members in provinces across Canada with consideration of the broader challenges facing families who are not part of the union, who have children with disabilities, to access services and supports to meet their needs and interests. So again, based on the challenges that they've seen amongst their workers in trying to maintain their employment while supporting children with disabilities. The third example I want to talk about is a relatively new initiative, the Family Support Network for Employment. This is a family-led coalition that seeks to engage individuals labeled with intellectual disabilities and their family members in supportive networks around employment specifically, as well as social infrastructure and resources. So they have a particular focus on employment for people labeled with intellectual disabilities in Ontario. It's run by and for families of people with intellectual disabilities to address gaps in resources and supports for families to increase inclusion of people with intellectual disabilities via employment. So viewing employment as a conduit for greater social inclusion, and in recognition of the challenges that families face, the lack of resources that they get, and the downgrading of responsibility to families to do it all. So they offer education and advocacy resources for the development of effective employment resources and supports for family of people with disabilities in Ontario. So the key word there is effective. So it's based on a premise that the current system is ineffective. So those are just 3 quick examples that I wanted to talk about. Again, not an exhaustive list. But in thinking about this, some of the other work that I've done with and beyond these projects is around evaluation. And so how do we evaluate progress with this? How do we critically look at responses to addressing the systemic challenges and barriers that we've talked about? How do we support monitoring and evaluation of some of these community-based approaches, and what do we call, how do we define progress? What are some of the evaluation approaches that we can use? So I've used things like developmental evaluation, realist evaluation, participatory evaluation, all different approaches that can be used to support organizations to build their capacity to assess the impacts of the work that they're doing. But there's also a need on the flip side of this to develop accountability mechanisms to address system fragmentation. So in initiatives that are being developed by government and by policymakers to address some of these challenges, what's being done to hold them accountable? So 2 questions I just want to leave you with is, who decides what progress looks like in addressing these challenges? They're well known, we know they exist. And how do we address the need for accountability for system fragmentation, and who is responsible? So in sharing these 3 community-based approaches, I think it's great to see the community addressing it, but is it their responsibility is one of the questions that I'd like to pose. Thanks.
Thank you very much, Alexis. We have our first discussion question. Good timing, Steve. So now we have lots of time purposely left for you to contribute your ideas, which we'd really like to hear about, because this synthesis report is an evolving document, and we're looking forward to discussing your ideas, particularly in this case about how to improve this complex web of disability supports that we have in Canada, so that Canadians with disabilities will have fewer challenges in navigating it. So if you'd want to speak out loud, that's great. You can raise your hand by using the raised hand button at the bottom of your screen. A technical person will unmute you. You can speak in English ou en français, because we have simultaneous interpreters. And please speak slowly so the interpreters can follow what you're saying. If you don't want to speak, you can put your comments in a Q&A box, not in the chat box, please, because we'll be focusing on the Q&A box, and then I'll read them out loud for the interpreters. So we have a question from Steve Mantis. Thank you, Steve. I should note that we had 43 participants, I think, in this session, so lots of possibilities for questions. And Steve's question is, are there any past or current initiatives that are engaging policymakers and system partners that have reduced barriers or are reducing barriers to accessing services and reports? Does anyone want to tackle that, Steve's question?
I can maybe speak to that.
Sure, thanks, Alexis.
Yeah, this is a good question, and something that has been on my mind as well, was hence the need, I think, for some monitoring and evaluation that's published, not just in scholarly journals, but in community reports on the extent to which some of these initiatives to address fragmentation is working or not. I do know that the Canadian Union of Postal Workers has had some success in supporting their members to gain access to better supports to help their families to get access and be aware of the kinds of disability services and supports that are available in their local communities. The Family Support Network of Employment for Employment, they're a relatively new initiative, but they have been connecting with families and sharing education and information on what the system looks like and how to advocate for more, being from like an informed place. But I don't know to what extent these organizations are necessarily working with policymakers to make that change. However, the Council of Canadians with Disabilities has had a long history of advocacy, and their work is being funded by, I think, Employment and Social Development Canada. So I think there's hope there. I just don't know for sure.
Thank you, Alexis. Steve, does that answer your question? And Steve has raised his hand.
Thank you, Margaret. Sorry, I'm still technically challenged. That is helpful. We have a long experience in Ontario with the Ontario Network of Injured Worker Groups to advocate for better services from the Workers' Compensation Board. And, our experience is that as advocates, there's rarely an opportunity to really engage with policymakers or decision makers. Yes, you can take part in a consultation. Yes, you can meet sometimes if they're willing and share your experience. But to have like an ongoing relationship to actually try to improve things is very rare. There have been two experiences in my 40 years of advocacy, and the one was when I was appointed to the board of directors of the Compensation Board in the early 90s. And as a member of the board of directors, there was a role ongoing to participate in some of these issues around access to services and supports, which really speaks to having people with lived experience in decision-making roles on an ongoing basis, so that it's not the exception, it's something that happens all the time, and that the systems that are providing supports and services could actually learn from that to make sure that people with lived experience are involved in that decision-making process ongoing. The other example happened about 10 years ago when we had a very large partnership with academic researchers. And the project was called the Research Action Alliance on the Consequences of Work Injury, where we were able over a period of 2 years to work with senior management, once again at the Compensation Board in Ontario, to try to address the issue of stigma that many workers experience, not only in the compensation system, but in many parts of their lives in society in terms of healthcare and other systems as well. And that was also a very unique experience, but it was one where senior management, like we've heard throughout this conference, say, yes, we want to address this issue, we want to make improvements, and then empowering their staff to actually implement a number of positive changes that affected thousands of workers in a positive way going forward. As Normand mentioned in his presentation, the political realm oftentimes can take over, and it did take over after about 5 years in our experience, and that initiative kind of went by the wayside because the focus now was on reducing costs at the system, and stigma is an effective way to do that. So Yeah, sorry for being so long-winded, but this is so important about how do we know this should be better. We know there should be system navigators. We know that the system is fractured, but how do we then move forward to actually making it better? And I really hope to hear from others around examples of how we can do that.
Okay, thank you very much, Steve. Normand has raised his hand, so go ahead, Normand.
Oui, merci Margaret, c'est très intéressant, Steve, effectivement. Ça pose la question aussi, est-ce qu'on devrait être, Alexis parlait de mesures de résultats, est-ce qu'on ne devrait pas être plus contraignant à l'égard de l'offre de services, mais des résultats aussi qui sont attendus? Je donne un exemple, Margaret parlait de complexité au niveau du contenu, par exemple, des programmes, les gens ne savent pas à quoi ils ont accès, ils ne comprennent pas toujours les trucs. Est-ce qu'en termes d'accessibilité, est-ce qu'on ne pourrait pas rendre des contenus beaucoup plus faciles en termes de compréhension pour faciliter l'accès aux gens aussi? Mais je pense que l'aspect contraignant versus au Canada, on a une tendance à être plus consensuel. Hein? On incite beaucoup les travailleurs, ou pas les travailleurs, mais les employeurs sur une base volontaire. Est-ce qu'on ne pourrait pas être plus contraignant sur différents aspects pour rendre les services plus accessibles aussi? C'est une question qui se pose souvent dans le milieu associatif en termes de mesures de résultats. Est-ce qu'on doit aller plus loin de ce côté-là?
Merci, Normand. Alexis, do you want to add anything? I don't think anybody's got their hand up right now about evaluation measures that you mentioned at the end of your talk. How evaluation measures can contribute to making sure that involvement of people with disabilities and lived experience actually happens and changes things.
Did you want me to speak to that a little bit?
Yeah,
more?
if you want to.
Yeah, one of the things that I didn't really get to talk about, so thank you for opening this up, was that I think evaluation can be great for promoting strategic learning and decision-making in any sort of program development, and supporting organizations, particularly community-based organizations and organizations of people with disabilities, to do that in a way that's going to advance their mission and their vision and support their efforts. But the slippery slope there is that sometimes evaluation is imposed upon organizations to meet other benchmarks or indicators as defined by the funder in some way. So it's important to, I think, support the kind of evaluation that will help communities address these challenges. But I think also one of the questions too is not just how do we support people to manage this system, but actually change the system itself. The complexity and the fragmentation is the problem, and that needs to be resolved. And so when there are government-led initiatives, either in the province or federally, to support system navigation, maybe we also need to question the need for navigation itself. Why do people need this kind of support to do that? So evaluation can, I think, be a great tool, particularly if it's done from a participatory, community-based approach and working with organizations to develop their own evaluation plans and monitoring mechanisms, as well as to demonstrate and look for ways in which to improve their processes and outcomes. But on the flip side, how do we also evaluate what's being done by those who are creating the policies and services that are so fragmented? I see Marcy has her hand up, so I'll pause there.
Okay, we also have a question that's just come in, which is for Normand. So I think I'll take that first, and then we'll have you, Marcy. Is that okay? Yeah.
Okay, I just wanted to add, Alexis, I agree with a lot of what you're saying. You mentioned about a slippery slope. I just want to add that one of the things I think when people are evaluating, we need to add about, there's a lot of fighting when you talk about money. We're leaving that. It's like the elephant in the room. All the nonprofits and the government are fighting over like a pot of money. So what happens is sometimes, not everyone, but sometimes people are not giving the care they need to give when they're helping someone through the system, because it's not about having one person. It's about having as many as you can so you can get more money for the following year. Okay, and that is very, very important. And we haven't mentioned it yet. And that's a big factor. And what's happening is right now, that's the biggest factor, because right now, all over Canada, you know, we're giving money for this and money for that. And people are saying, oh, wow, we got to jump into it because money is where disabilities is. And I've had so many emails, people saying, I'm going to get into disabilities because that's where the money is. So I think that has to factor in when people are doing evaluations. Money. Anyway, thank you.
Money, money, money. You're right, Marcy. We have a question on the Q&A for Normand. I'll read it out loud for the translators. Bonjour, merci à tous pour votre contribution. J'ai une question pour Monsieur Boucher. Vous avez mentionné l'option de créer une forme de guichet unique pour les programmes destinés aux personnes vivant avec un handicap. Comment un tel guichet pourrait-il s'arrimer avec le système fédéral du Canada où les provinces ont les domaines de prérogatives propres à elles? À vous, Normand.
Merci. C'est une très bonne question, effectivement, puis c'est toujours dans le contexte d'un régime fédéral, hein, par rapport à ça, donc le partage des pouvoirs en fonction des pouvoirs, en fonction des zones de juridiction. Je pense qu'on peut l'imaginer au niveau provincial, qui peut être mis en place aussi, mais on peut penser qu'il peut couvrir en fonction des thématiques comme le travail, par exemple, on peut penser. On le fait pour certains programmes en habitation où on voit qu'il y a des mesures qui existent pour l'accessibilité, soit au fédéral ou au provincial, en fonction des critères. On peut voir si donc, je pense que c'est possible de conjuguer à la fois selon les initiatives. On voit au Canada qu'il y a certaines provinces qui sont plus proactives, hein, sont plus interventionnistes, entre guillemets, en termes d'intervention, de développement de services et de mesures, alors que d'autres le sont moins. Je pense qu'il faut essayer de coller, si on veut que ça fonctionne, c'est mon point de vue, il faut essayer de coller un peu à cette réalité-là, hein, respecter un peu la culture ou l'histoire un peu qui est de chacune des provinces en matière d'intervention, mais je pense que ça pourrait être intéressant de pouvoir orienter les gens en fonction. Un organisme le fait pour ses programmes et ses mesures, mais un guichet unique, l'avantage que j'y vois, c'est qu'il pourra couvrir tous les types de mesures à l'intérieur de ça. Donc là, c'est plus facile. Il y a des entrepreneurs, je pense que dans le passé, il y avait un 800 Frank McKenna au Nouveau-Brunswick qui visait à aider les employeurs à trouver des solutions facilement, des programmes de subvention. Pourquoi pas penser un système un peu comme ça pour des travailleurs, des personnes qui ont des incapacités, des travailleurs accidentés qui auraient besoin de soutien ou d'accompagnement sous différentes formes à l'intérieur de ça. Je pense que ça peut être un truc on est beaucoup axé sur la technologie, hein, de plus en plus par rapport à ça. Il y a des volets, je pense, qui peuvent rendre ça maintenant peut-être plus facile que par le passé. On peut imaginer un truc comme ça.
Merci pour ça, Normand. I don't see any. Do we have a panelist with their hand up? Marcy, or is your hand, do you want to speak, Marcy? No, you're lowering your hand, okay. Do any of our panelists want to say anything that they didn't get a chance to say? We have about 5 minutes left in our session. So can you unmute yourself, Marcy, if you want to say something?
I just wanted to ask, like, I guess the panelists about unconscious and conscious bias. Did they talk about that, or did that come up in your research? Because, you know, that comes up a lot when people are looking for jobs. That comes up more than anything. You know, even when we're trying to get them mentoring or we're trying to get them a volunteer experience, the unconscious bias is like a huge block constantly. So did that come up in your research? Thank you.
Oh, Yvonne's got her hand up. Do you want to answer that question, Yvonne?
Yeah, sure. So okay, yeah. So I'm not sure how many of our delegates attended the December 1st, one of the session that my colleague John Stapleton, he talked about one of our recent work on what it's called What Stops Us from Working. And we were focusing on the ODSP recipients, discussing why it's so hard for them to access employment. And what we developed 6 theory, and one of it, it's we believe the main assumption placed on people with disability who are looking for jobs are wrong. And there is a lot of barriers that people with disability experience while they're looking for jobs that when people do not have lived experience just cannot understand. And those biased views are applied even in the service that were supposed to help those recipients to access the service that they need. John wrote this report in 10 years ago. First version of the report was in 2010, and a lot of suggestions he made back then are actually still not achieved even after 10 years. So this is also something that we actually didn't have an answer for, and we just have to try keep advocating for it. I hope that adds something to your thoughts, Marcy.
Yeah, go ahead, Marcy.
Okay, thank you, Yvonne. But Yvonne, what do you think? Like, you told me what his research said, but what does your research say, or what do you think?
Oh, that's I'm a co-author of that report. So what I said, it's what I just said, it's my opinion as well.
It comes across in some of the vignettes as well, that I've watched all the vignettes and they all talk about barriers. And there's one particular vignette where the woman talks about she lost her job because she couldn't get accommodations. And this was also mentioned in a session I attended today about workplace bullying, that not giving somebody an accommodation is a form of harassment, and it can be a way of pushing someone out of a job. So there are still many issues, and that might be a kind of implied bias that you're talking about, Marcy, is harassment on the job and bullying people out of their jobs, or not renewing contracts. In her case, she said that this was Sabrina in the vignette. She said that she didn't pass through the probationary stage of her job. She couldn't get the accommodation she needed. And her rationale was, well, I don't want to work for them anyways, but this is also a human rights issue. We've got about a minute or two left. Let's see, maybe we'll go to Normand.
Oui, merci Mariette. Oui, la question des biais tout à fait est importante dans la mesure où on en a tous. Il y a un lien, on fait un projet actuellement sur les obstacles que les gens rencontrent dans la recherche puis dans la vie au travail. Puis après ça, on se rend compte que la moitié de nos répondants, sur plus de 170, ne veulent pas mentionner qu'ils ont un handicap lors de l'entrevue ou avant l'entrevue ou après, parce qu'on ne peut pas craindre d'être discriminé par rapport à ce volet-là. Lorsqu'on regarde les données statistiques qui sont officielles, qui confirment ça. Hein? StatCan, on voit des trucs par rapport à ça que les gens ont indiqué qu'ils avaient été ils avaient été victimes de discrimination. Donc, tous ces biais-là sont présents, inconscients ou conscients. Faire de ça, puis ils se traduisent parfois par des préjugés dans le cadre de l'emploi. La crainte, elle est vraiment partagée. C'est fascinant pour nous, c'est très polarisé, c'est 50-50. Ce qu'on dit, on ne dit pas par rapport à cette dimension-là, puis les gens, parfois c'est positif, parfois non, sur cette dimension-là, mais ça vient jouer. C'est l'obstacle, je vous dirais, Steve mentionnait tout à l'heure de la stigmatisation par rapport aux travailleurs accidentés. Cette dimension-là reste toujours difficile, c'est sur laquelle on a le moins d'emprise. On peut jouer sur l'aspect économique, on peut donner des compensations, mais sur l'aspect des valeurs et des attitudes à l'égard des gens, des travailleurs, c'est très difficile, ça prend du temps à changer. On a fait des campagnes depuis plusieurs années, puis ça reste encore un sujet qui est difficile à aborder. Puis, je trouve quand même qu'il n'y a pas de recette miracle. Je ne sais pas. Des fois, c'est quand les gens qui vivent la situation en parlent eux-mêmes. Parfois, c'est mieux. Il y a pas de, mais je pense que c'est un volet qui est important aussi.
Merci, Nelmont. We have to close now. We're running out of time. I just got a message from Emile who needs to close the session for the day. So I thank you all panelists very much and participants, delegates as well for your ideas. And thank you for a wonderful session. Over to you, Emile.
Yeah, thank you, Margaret, and panelists. It's been a great discussion. There's clearly lots of work for all of us to do going forward. It's not a perfect system. There's lots of barriers to accessing the services and support people need. Navigation is a huge challenge, has been pointed out by all of the panelists. So there's work out there for us to do. I want to thank everybody who's attended this session and just remind people we have another day of informative keynotes and parallel sessions tomorrow. So do please join us for the session tomorrow. That's our last day of the conference. We look forward to everybody being there with us and helping us close up the discussions we've had, the great discussions we've been having over the last few days. And thank you very much for your attendance and participation in this session. Take care, everybody. Have a good evening.